So we've got the patient in front of us now, and they came in with some signs and symptoms. And what are the ones that make you most, think about, blepharitis, MGD, rather than aqueous deficient? What are the ones that make you think most about aqueous deficient? So, Eric?
Well, there are a couple of key symptoms that you look for in patients who have meibomian gland disease. Kind of the rule number one is that patients tend to have symptoms worse in the morning when they wake up because their meibomian glands have clogged overnight and they're more irritated. There's more of the soaps and fatty acids there. They also have a tendency to have a very strong visual fluctuation. The vision fluctuates during the course of the day. They can complain of foreign body, irritation, redness. Sometimes eliciting a history of a chalazion, for example, is just pathognomonic of meibomian gland disease. And I don't want to go through the whole litany of symptoms they have, but that's a good starting place to look for in these patients.
Yeah, I mean, I'm your patient, so I have mild MGD, and I would say blepharitis burns. It's kind of a burning sensation. Why does it burn?
Well, that's a great question, and it's very simply basic biochemistry, is that the lids secrete triglycerides, and the bacteria, mostly staph in the lids, secrete lipases. These lipases break down the normal triglycerides into the components, which are soaps and fatty acids. So people who have meibomian gland disease actually have soap and acid in their eye. And if you look at their lid margin and you see that little white foamy material in the lid margins, that's my first question I say to a resident. I say, what do you think that is? And the answer is, that white material is soap. And that's a sure pathognomonic sign the patient has meibomian gland disease. And that's why they complain of burning. They really have soap and acid in their eye.
And it itches a little, but it's different than the classic foreign body sensation later in the day of aqueous deficient. So do bacteria, microbes matter in this disease? Steve, do you think they do?
I believe strongly. I think that lid margin disease might be the first domino in a sequential process to eventually get to ocular surface disease. So I pay attention on blepharitis on young people like I never did before. You would look at an 8-year-old that has very early stage anterior blepharitis. I'm recommending lid hygiene. And we've embraced that as becoming our standard.